Welcome back to the King's Podcast, the Wellness Dive with Lucky. I'm your host, Esther Lackie. As we continue to highlight Colorectal Cancer Awareness Month, where doctors and other experts insist that screening is key to an effective cure of the condition. Today we are joined by Dr. Yaser El-Gazzar, UK board certified consultant, gastroenterologist, and hepatologist, and the UK accredited bowel cancer screener. And he'll be taking us on a deep dive into what bowel cancer screening is, what it entails, and what to expect. Dr. Yasser, I hope I got your name correct.
Hi, Esther, correct.
Thank you so much for joining us today. We know you have a busy clinic. Yeah, so I'm going to start by asking you, just like I ask everyone else here.
Yeah.
What is bowel cancer?
Bowel cancer happens when the cells lining the colon grow out of control and start to form tumor, which is like malignant tumor. We call it colorectal cancer.
Mhm.
And this kind of cancer is basically affect either part of the lower part of gastrointestinal tract, either colon
Mhm.
or the lowest, about 15 centimeter, which is called the rectum. That's why it's called colorectal.
Colorectal,
Yeah,
but then we call it again bowel cancer. Sometimes we call it colon cancer.
right.
Okay.
It is different name for the same thing. Yeah.
All right, doctor. So let's go forward and tell us what exactly is the colorectal cancer screening. What does it entail?
Right. Colon cancer is a second to third most common cancer worldwide, depending on the area.
Mhm.
And it is the same in UAE. And it is a preventable and curable cancer, I mean, detected early. So the idea of bowel cancer screening is two things: to prevent the cancer first, and this by doing like colonoscopy,
Mhm.
seeing a precancerous lesions, remove them. So this prevent the cancer completely.
Mhm. So these lesions, they don't have to be cancerous.
Yes, correct.
Just lesions.
Over years, it is lesions. It's called polyps.
Uh-huh.
So over years, over 10 years or more,
Mhm.
this can convert to cancer.
Uh-huh.
And we know that. So
Yeah.
when we do the colonoscopy and find this lesion,
Mm.
though they are benign lesions, but they are potentially precancerous. So removing that will prevent
Mm.
the cancer happening.
Uh-huh.
Then the second aim of bowel cancer screening program
Mhm.
is to detect cancer at early stage. If we can see and diagnose the cancer at early stage,
Mhm.
this is potentially curable cancer. So the cure rate can reach up to 90% in patients detected in early stages.
Now, doctor, you mentioned precancerous lesions.
Yeah.
Do we know what causes these lesions to occur in the first place?
We don't know exactly what the cause of these lesions, but some of them are genetic, so it runs in family.
Mhm.
So people who has family history of colon polyps
Mhm.
are more susceptible to have colon polyps, which are precancerous lesions. And
Mhm.
these patients take priority for bowel cancer screening.
So we know somebody cannot just be sitting at home and they decide one day to get up and come to say, Dr. Yaser, please screen me for bowel cancer. So exactly at what point is the screening recommended?
This actually different from different countries and depends on many factors. For example, in UK, this is one of the strongest bowel cancer screening program worldwide. It starts now at age 60
Mhm.
till 75. But it's expected to be lowered. I mean, aiming to reduce the start age of screening to 50. In UAE, researchers has found that people are diagnosed with colorectal cancer at younger age than other countries. For example, than the people in United States. So the recommendation here is to start bowel cancer screening at age 40 for everyone who has no symptoms. But people who has symptoms should get screened at any time once they get alarming symptoms.
All right. So what if some of these individuals have certain risk factors? Can they be screened below the age of 40?
Yes, correct.
Mm-hmm.
For example, people who has family history of colorectal cancer,
Mm-hmm.
especially if the relative was diagnosed at young age, or more than one first degree relative diagnosed with
Mm-hmm.
bowel cancer, these people get advised to get screened 10 years earlier than normal population. So if you're starting at age 40, this high risk people should be screened at age 30.
Oh, that's very young. So the screening tests recommended for bowel cancer, and how do they differ from the UK and here in the UAE? How
Right.
do these two countries or other regions differ when it comes to screening?
Okay. UK has a well-established bowel cancer screening program, which started more than probably 12 years ago or 13 years ago. And this program has been changed over the years to reach the optimal way. So the idea is to get everyone at age 60 to send a stool kit at home to do stool sample and send the kit back to the program.
All right, so just to get it clear, in the UK, they do it in the privacy of their own home, using
Correct,
home kit.
correct.
Oh,
And
right.
this happens automatically.
Uh-huh.
The program generate
Uh-huh.
who reach age 60, send them the kit
Automatically they get.
automatically, send them the kits,
Mhm.
kits come back. If the test come back positive, they are invited to have a colonoscopy.
Mhm.
Everyone with positive test invited to have a colonoscopy.
Yeah.
And then if the colonoscopy is negative, there is
Mhm.
no problem. Go back to the screening program. So they get sent the kit every 2 years.
Oh,
Yeah.
that's amazing.
As far as it's negative, it continue to the programs continue to send them every 2 years until they reach age 75.
All right. What about here in the UAE, specifically here at King's? What kind of tests do we run?
In Kings here and in UAE, there is no established program at the moment, especially in Dubai. Um, uh, I mean, the gastroenterologist normally, this is what I do as well in my clinic. Uh, People who reach or patient who reach age 40, I offer them a colonoscopy, the bowel cancer screening, either colonoscopy or stool test, and we'll take it from there.
Mm-hmm.
If they have alarming symptoms, of course, at any age, they are invited to have the screening test
Mm-hmm.
at any age. There is different ways of doing the screening in Kings here.
Mm-hmm.
We can do the non-invasive stool test, which is quite sensitive test. And I mean, the national recommendation here is to do this test every year. So we do that from age 40 every year.
Mm-hmm.
The other methods of bowel cancer screening is colonoscopy, which is the gold standard.
Mm-hmm.
We normally do like an index colonoscopy when people reach 40. Screening colonoscopy means doing colonoscopy for people who has no symptoms.
Mm-hmm.
So we're talking now about all people who has no symptoms at all.
Mm-hmm.
So we recommend colonoscopy at age 40. And if this come back negative,
Mm-hmm.
we'll do a stool test every year. We can repeat the colonoscopy every 5 to 10 years. Other methods, some patients are not suitable to have a colonoscopy. There is other ways of doing bowel cancer screening,
Mm-hmm.
like a CT colonography, which is like a virtual colonoscopy.
Mm-hmm.
So the CT is done. There is a software to convert the picture of the CT,
Mm-hmm.
similar to the picture we get in the colonoscopy, and it's quite sensitive to detect lesions above half centimeter or 5 millimeter. If this shows any problem, like polyps, the patient has to come back to have colonoscopy to get this polyps removed. So this is the disadvantage. But there is a category of patient who has other diseases, comorbidities, who cannot tolerate the colonoscopy.
Mm-hmm.
So unless we really need colonoscopy,
Mm-hmm.
we try to avoid this with a less invasive procedure. There is a novel way of doing screening as well, which came to the scope in UK in the COVID period, which is colon capsule.
Mm-hmm.
Colon capsule is a simple test. A patient swallow a like a capsule similar to antibiotic capsule
Oh.
with a camera at
Mm-hmm.
both end.
You just swallow the camera and it shows everything.
Yeah, and it shows everything. And this, I mean, in COVID period, I mean, it has a lot of advantage that it decreased the personal contacts. And during the pandemic, uh, now it's, I mean, I have a good experience in that because I've done many of the colon capsules in UK. Unfortunately, is not available yet in UAE, but I've been in contact with the manufacturing company, and hopefully soon we will introduce that at King's.
Are there certain individuals or rather a certain segment of society who that colonoscopy is not recommended for them? As in, you would say it's not safe for them to undergo a colonoscopy.
Do you mean a special group of people?
Yeah.
Yes, of course. People who has comorbidities like advanced heart disease, people who have bleeding tendency, or taking high risk, taking anticoagulant to thin their blood, and they are high risk to stop the anticoagulant. So and people, especially people who we do not expect that they may have something serious. So we prefer to do the non-invasive test first and avoid the invasive test unless really needed.
So there's always a way around every.
Yes, absolutely. There is alternatives to colonoscopy.
All right, doctor. So before I let you go, is there a way that is there something we can do or things we can do, lifestyle changes, to reduce the risk of developing colon cancer?
If we look at the risks of bowel cancer, there is some non-modifiable risks which we have no control in it, like as I mentioned, genetic factor, age, as people getting old, controlling that.
Right, you don't get
Absolutely.
old.
But there is modifiable risk factors which we can change,
Which are
such as obesity. So we will,
is always falling on this podcast.
absolutely,
Every
absolutely.
doctor has to
It's
do
the
obesity
risk
for
factor.
everything.
It's a risk factor for most of diseases.
Diseases,
Yes.
yeah.
Smoking, alcohol, diet. So people who eat junk foods, red meat, and excess fat, and low vegetable and fruits are at risk as well. People who has family history should again go for screening. Going for screening at the right time will prevent the colon cancer.
Is screening for bowel cancer painful? Should I
Talking
have a
about
result?
colonoscopy in particular?
Yeah, colonoscopy.
No,
Is it
no,
painful?
no, no.
No?
It's definitely not painful. And here it's done under deep sedation, so the patient will sleep completely. And if it's done by a bowel cancer screener or accredited bowel cancer screener, we used to do it in UK, even without sedation at all, and it shouldn't be painful.
All right, doctor. Thank you so much.
No worries.
And thank you for finding
You're welcome.
Join us here.
Thank you for having me.
Yeah, there you have it, Dr. Yaser. Get screened for bowel cancer. And to add on to that, colonoscopies are not painful at all. In fact, the good doctor used to do them without any sedation back in the UK. But here at King's, it has to be done under sedation. Until next time, bye.